Hi, I'm Randy Forehand, and I'm an allergist and immunologist for Clinch Valley Health, located at Clinch Valley Physicians Associates. An allergy is an exaggerated response to the exposure to certain foods, such as milk or peanut, or an allergy to your pet, pollen such as trees, grasses, and weeds, or even your house dust. An allergic reaction is this exaggerated immune response. It's your immune system, which normally protects you, but sometimes it gets a little bit carried away and reacts to things that are normally in your environment, such as food or pets or pollens. Anybody is capable of developing an allergy, although there are certain genetic factors that may make you more likely than someone else to develop an allergy, although anyone can develop an allergy. Well, allergies tend to affect the respiratory tract, the skin, and your gastrointestinal tract. Respiratory symptoms might include nasal stuffiness, or a cough, or even wheezing. Certain rashes are a sign of allergic reactions, or persistent upset stomach might be an indication for a food allergy. The best method, and the one used most frequently by allergists, is the skin test. More recently, they've developed blood tests, and probably a combination of the two actually gives us the most information. If someone is diagnosed with an allergy, particularly a respiratory allergy, we have a choice of beginning with an antihistamine, such as Claritin or Allegra or Benadryl, and one of the nasal sprays, such as Nasonex or Rhinocort or Nasacort, which are now mostly over the counter. On the other hand, if these treatments are not satisfactory, we might consider allergy shots, also called immunotherapy. An allergy shot works by building up your immunity very similarly to a polio vaccine or a DPT shot. If you start with very low doses, your body will actually develop an immunity to whatever it is that we are treating. We can develop an immunity or build up an immunity to pollens or to a pet dander, or possibly in the near future to food. An allergist also specializes in diagnosing medication allergy or drug allergy. If we find that someone does have an allergy to a drug, such as aspirin, or maybe to one of the antibiotics, we have the option of trying to desensitize them so that their body is no longer allergic to that drug and they can take it safely. If a patient decides to take an allergy shot, we sit down and discuss with them the schedule and also potential side effects. The most common side effect is slight irritation at the shot site, but there's always a very low risk of a more serious reaction. Normally, if someone chooses to take allergy shots, they'll come in 2 or 3 times a week in the beginning until they're built up to their maintenance phase. Once they're built up to maintenance, we ask that they try and go 5 years. I'm often asked whether I can cure someone of their allergies, and I tell them the only disease I've ever cured is strep throat. Everything else is controllable, so I can control allergies with the use of antihistamines, nasal sprays, and of course allergy shots. Once we diagnose allergies, there is a chance that once the patient reaches ages 18 to 20 that they actually may outgrow them. Probably 30 to 40% of individuals do outgrow their allergies, but then the majority probably keep some degree of allergy most of their life. an individual shows evidence of allergy or symptoms of allergy, I think it's important to be diagnosed because allergies are very irritating. They prevent someone from sleeping soundly. They prevent people from concentrating at school or at work. And they're basically miserable from blowing their nose and coughing all the time. I think it's important that if you suspect an allergy, that a patient have a very thorough, complete workup so they get their answers. Each spring, if you find yourself getting sick, there are a couple of straightforward ideas you can try. One would be to start taking an antihistamine to see if there's any difference in symptoms. You can also keep all your windows and doors closed at home to keep the pollens out. There are dust precautions that can be taken in the bedroom, and also the knowledge with daylight savings that pollen counts are at their highest midday. So if you plan your day so that you're outside more in the morning or taking advantage of daylight savings and staying out at night, but staying in at midday, I think you'll very quickly get an answer as to whether you might have a pollen allergy. In childhood, typically allergies first become apparent at around age 10, 11, 12, although I see children as young as 1 year of age, particularly with food allergies. But many patients present at age 40 or 50 having their first allergic symptoms. So although the average patient first comes to me as a child, I see individuals of all ages with the recent onset of allergic symptoms. A good example of an older individual developing allergy is a lady I had in my practice who wanted to live closer to home to her children. But when she moved into her home, she later found out that she had house dust mite and developed an awful allergy. Once we saw her, we were able to give her appropriate therapy, including teaching her how to clean her home thoroughly, which almost cured her allergy. Another form of allergy is asthma, and with appropriate testing, we might be able to determine what your triggers are and help you better control your asthma symptoms. I had people who were coming in with asthma. Turns out they were having a reaction. One had a reaction to a drug they were on. The other was drinking water that was contaminated with a parasite. And once we got rid of the parasite, their asthma went away. So I mean, there are all sorts of examples. If a patient decides they'd like to see an allergist, a referral is helpful in order to get medical records, but it's certainly not necessary or required. If you or another member of your family thinks you have an allergy, I'd be happy to sit down and discuss this with you. You can call my office to schedule an appointment at 964-1229.